Well, hi everybody. Today we want to talk about the dangers around medicines and household cleaning products, otherwise known in the house as poisons. We know that both cleaning products and medicines can help us and certainly help our bodies and help our houses stay clean. But there are some things to be aware of. First off, we want to know what exposure is. Exposure to household products or medicines can be done by inhaling them or breathing them in. They can be on our skin by getting something on our skin that shouldn't be, or they can get into our eyes and cause eye irritation. Some symptoms that you may have been exposed to a harmful chemical are if you inhaled chemicals or breathe them in, you can experience nausea, headaches, nosebleeds, dizziness. You might lose your memory for a little bit. You might not be able to breathe so well, have shortness of breath. And if you have asthma, it can cause asthma attacks. If you touch a chemical that could cause irritation, that chemical may cause very bad itching or burning of your skin. If chemicals get into your eye, it could cause eye irritation or burning eyes, could cause inflammation around your eyes, or it could cause temporary or permanent blindness or loss of your vision. It can be confusing when we see products in our house that look a lot like the sports drinks or juices that we drink. So we should always be mindful of what it is in our house and never, never, never drink anything that you don't see the label on the bottle for. If you swallow any amount of a household product, a cleaning product, you could have symptoms that are anything from a mild headache, nausea, diarrhea, throwing up. You could have breathing trouble, or you could have trouble keeping your head, like dizziness. Other reactions might be a burning throat or throat pain, burns to your lips and mouth, and permanent damage to things like your skin that can occur. Chemical products should always be kept in their original bottles or containers to avoid confusion. You should never, ever, ever drink any unknown liquid from a cup, a bottle, or a jar. Many liquid cleaners are colorful and they appear to be the same thing or same color as Kool-Aid. So again, be very aware of what you're drinking. In a poisoning emergency, the Poison Control Center can be called at 1-800-222-1222. When you call that number, they'll give you information if you tell them what it was that you drank or ate or came in contact with, and they can tell you what to do next. If you can't remember that number or don't have it posted on your refrigerator, call 911 immediately. They'll either put you in contact with Poison Control or they'll help answer your questions there. Make sure that these two numbers are on your refrigerator. If you need to stop this video, write them on a piece of paper and stick them to your refrigerator now. That's a good idea. Medicines, on the other hand, can be found commonly in homes and even in places that you might see as safe, like grandma's purse or grandma and grandpa's house. It can be difficult to see the difference between medicines and candy because medicines and vitamins come in pretty much the same colors and shapes as candy does. If you don't know what something is, do not put it in your mouth. You should always ask a grown-up first. The best person in the home to give you medicine is your parent. But past your parent, it may be necessary for your babysitter, a grandparent, or a guardian to give you medicine. If medicines or household products are found on an adult should be told, so that the container can be placed in a medicine cabinet or somewhere out of the reach of the children in your house. You should always tell a parent or teacher if household chemicals like cleaners or medicines are found in an unsecured area, somewhere that a little baby could get in touch with it. At school, you can seek out a teacher, a nurse, or a guidance counselor, or even your principal or dean for answers regarding medicines or household product emergencies. Remember, if you have an accident with a household item, such as a cleaner or medicines, it can be very serious. Call Poison Control at 1-800-222-1222 or call 911. Now, if you didn't do it last time, make sure these two phone numbers are on your refrigerator. If you need to pause the video, pause it now, write down those numbers, and stick them to your refrigerator. They're very important numbers. If you do have an accident and you call 911 or Poison Control, you need to be aware that they're going to ask you questions that you'll need to answer clearly and loudly so they understand you. It's important to give accurate information to the dispatcher, the person who answers the phone. And be sure, if you can, to tell them your address or your location. Tell what happened and the number of people who are involved in what happened. For instance, if you're somewhere where you breathed in something that was a bad fume, you need to say whether or not other people around you also breathed it in. If some emergency like this happens at school, tell the teacher immediately so they can call 911. Thanks a lot for listening today, kids. Don't forget, write those phone numbers down and put them on your refrigerator. And have a great week.